Hi guys, so today we're going to talk about what to do if you're having your very first period ever. First of all, don't panic. We all go through this, and it's common to have your first period at the age of 9. Most girls actually go through the change at around 11, 12 years old, but the trend is moving downward. So lately, girls have been tending to get their first period at a younger age than before. Don't worry, this is completely normal. Your body's going through a lot of changes. It's very common to be very moody or sensitive or irritable when you're going through this change. It's common to be easily annoyed. Definitely, if you're having any suicidal ideation or homicidal ideation, or you're thinking about hurting yourself or others, you definitely want to ask for help, and there's help out there. So definitely, if you're having the very first period of your life, you want to let your parents know, or let your caregiver know, or whoever you trust in your life, let them know so that they can provide help. You're going to want to figure out if you're going to use a pad or a tampon or a menstrual cup. So usually for the very first period, it's just easier to use a pad just because they're easier to use. And I encourage you to check out our video on how to use tampons and menstrual cups. But for the meantime, I brought some pads so you guys can look at different ones, and there's different sizes and different shapes as well. So you can find the one that you like the best and what fits best, okay? So this is like a panty liner, but basically a pad looks the same except that it's thicker. So it looks like this. You should probably go change your pad every time you go to the bathroom. So maybe 6 to 7 times a day. And it's common for it to be stained, but not completely soaked. If you're soaking through your pads, you might be having too much bleeding. So you probably want to go see a gynecologist or your family doctor. It's common to just kind of like stain the middle part of it, and then so you toss it, you throw it away. Thong-shaped panty liners or pads also that they sell that you can use if you prefer, rather than these oval ones. And of course, you can always use a tampon or a menstrual cup. But as far as cleaning cloths or personal hygiene down there, basically soap and water is all you need. The wipies that they sell nowadays are not really necessary. I mean, some women just like it to feel fresh, but they're not adding anything. I mean, you basically just need to wash with soap and water, and that's enough. And you certainly don't want to douche, because douching will kill off the normal flora in your vagina, and it can make you vulnerable to infections. So definitely no douching. The cleaning cloths are, plus or minus, they're really not needed. If you like them, you can use them, certainly. So if you're between the ages of 9 and 16, that's pretty normal to have your first period. If you are younger than that, you absolutely want to let your parents know what's going on so that they can get you help if it's something that's abnormal. The first 3 days of your period are usually the heaviest ones. So like I said, 6 to 7 pads or tampons a day is what's considered normal. If you're soaking through pads that you have to change pads every half hour for more than an hour, that sounds like too much bleeding. So you probably want to get checked out, make sure that you're not losing too much blood, you're not becoming anemic, you don't need a blood transfusion, something like that. Usually periods last up to 7 days. So the first 3 days are the heavier ones, and then it might just linger on with like spotting up to 7 days. If your period is lasting longer than 7 days, that's definitely not normal, and you have to get medical care. Something that's really important is that once you start getting your period, you start to ovulate, so you actually have the potential to get pregnant. So I absolutely don't encourage any sexual activity at such a young age, but when you start your sexual activity is very personal, and whenever you do decide to be intimate with someone, and I think this is a great topic to discuss with your parents or with your caregivers so that they can counsel you and give you advice, you always want to make sure that you're being respected and that no one's forcing you to do something you don't want to do. Once you start having your period, you have to realize you can potentially get pregnant, and if you're sexually intimate with someone, they can give you an infection. So condoms always to protect against infection and pregnancy, or birth control method. Also, your period is too heavy. If you go on a birth control method, it can help you control the amount of bleeding that you're having. Another thing that young girls encounter when they start their menses is that the first few years your period might be very irregular, meaning it doesn't come every month, it comes like every 2 months, or maybe it's coming too often. So of course you want to go get checked out by a GYN, and they might put you on a birth control method, not for the purpose of birth control, but for the purpose of regulating the amount of flow that you're having and the frequency of flow, so that you get your period every month and that it only lasts like a week. So we use birth control to regulate the amount of bleeding that you're having and the frequency of your bleeding. Sometimes we use birth control to control acne, or we use birth control because it decreases your risk of ovarian cancer and endometrial cancer. So there's a lot of benefits to birth control. So if your daughter is having her first period for the first time, this is a great time to discuss safe sex sex practices, and you want to encourage your daughter to not become sexually active until she's old enough to understand what's going on and what she's doing, and definitely when she's in a committed, stable relationship. And usually this comes along, you know, when girls are older. I mean, when you're having your first period, you're like nine years old to early teenage years, so definitely that's a chaotic time to start your sexual activity, but that's a personal preference. I do encourage you to talk about this with your parents, and this is a great time to have an open channel of communication with your parents, and so you guys can be closer to each other and give each other advice and answer each other's questions. Don't forget to subscribe to the channel, like the video if you liked it, and email me any questions you may have at gynogal@gmail.com. Thanks. And just like the hair on your head, your nails, or your body, everyone has like their personal preference. I think we should go over what the options are. There's certainly the option of not